for allowing me to present to this group on something that I'm very passionate about, and making sure that we have the right quality of content available for people with really low literacy skills. So just a little bit about me. I'm a speech pathologist by profession. I've always worked with people with multiple and complex communication needs, particularly those with intellectual disability. So I've been clinically for 35 years. For the last 18 of those years, I've actually been focusing very specifically around Easy English. And Easy English came about in Australia because of the work that I'd done around analysing what was happening internationally and recognising that there was stuff being created called Easy Read, but it was still not simple enough for the majority of people with low literacy that we come across in our daily lives, both clinically and in the community. We also recognised that people with intellectual disability were not the only people who had low literacy. And so when we look at Easy English, we're looking at it from a universal design principles, in that what we wanted to do is actually create something that more people can engage with without barriers. So my team is based in Melbourne, and before I get going, I'd also just like to acknowledge the traditional owners of the lands on which we're all coming from. I'm coming to you from the lands of the Bunurong people of the Kulin Nation, which is southeast Melbourne.
It's just one of the ACI lunchtime webinars, literacy and access to written information. I'm just seeing if they've got any.
Sorry. Is that someone wanting to ask a question? No.
Just turned off their microphone. I think it was an accident.
Okay, that's fine. So I'm based in Melbourne, but my team are all virtual. So I have staff in New South Wales and in Queensland, as well as here in Victoria. And we're a specialist service. The vision I have is that actually we have a society that includes people with low literacy. And it's one of the things I want you to take away from this conversation is about who and how big is that issue. And the other mission that I have is around developing quality, meaningful, easy English that meets the needs of the intended reader. And so my other big message for today is that there are significant differences between easy English and easy read, and we need to be much more aware of that, and we need to be writing and creating content that meets the needs of the people who really are still being missed out if all we do is create complex, easy read. We've been very privileged in the last 12 months. We've actually received 5 awards for the work that we do in Easy English, and these are our 2 international awards that we've just received. I was in the UK late last year and also Austria earlier this year, being acknowledged for that work. The one for the UK actually came about through an Australian award of being recognised as the most outstanding communicator of disability in the NDIS sector. So someone somewhere is certainly recognising the work that we put out to make sure that it actually meets the needs of people with low literacy. So I want to take you just a journey for a few moments into the UNCRPD, which hopefully a number of you know lots about. I don't have time to go through the details, but I want to draw your attention to Article 21. When we talk about things in Easy English, we wouldn't use the language of article, we use part. And some of this article talks about, so it's about the right to information and the right to speak up, and you have a right to say what you think. And in part, what this actually does is identify all the different areas that people have a right to access. We're going to focus specifically on easy words and pictures, but what I also want you to think about is that just because you might put something in Braille, or you might put it in a different language, or you might put it in Auslan, are you actually taking it from the most complex version and assuming that in fact those people have really good literacy in the first place in their primary language? And when you look at the data around literacy and literacy needs, it would be a big question mark as to why we're actually taking something that's complex and putting it into a complex other language, or why we're putting it into complex Auslan when perhaps that's not the level that people are actually able to use on a daily basis. So easy words and pictures is the description of the broad category of what we're looking at. But let's look at the literacy data. So this is from the OECD in combination with Statistics Canada. In Australia, it was the ABS. It's called PIAC. You can see it looks like it's a little bit out of date. They were planning not to rerun this, and there was a big international, no, we still need the data. The reason they weren't going to rerun the data was because the data was the same across 3 different versions that they'd done across 15 or 20 years. Anyway, because of the pandemic, it's been delayed, but they're just collecting data now. So what does this look at? It looks at 16 to 65-year-old adults. It does not include people who live in institutions. And from my point of view, someone who lives in a group home lives in an institution, as do people who live in prisons, as do people who live in mental health forensic facilities. It also does not include rural and remote Aboriginal people. And so the data is far more damning in that space. So our general literacy tells us, our general data tells us that 44% of adults do not have the literacy to manage a range of day-to-day reading tasks. So that's been given, a brochure from Centrelink or a brochure from their bank or something from their health service, and they have difficulty reading all the words, being able to understand it and know what to do with that information. So that's pretty significant. When I first did the data, that was 7.3 million adults. It's now 8 million when you look at our current adult numbers. However, if we now think about it in the health space, lots of things that we do have to do with number. So if we're thinking about numbers, now it is not just 44, it's 53% of people. So it's more than half people do not have the numerical literacy. So that's things like being able to understand and use their medications properly, being able to read the instructions on it, being able to turn up to their appointments properly, knowing repetitions of things that maybe their physio is asking them to do in a really clear and easy way. Planning ahead, estimating, guesstimating. If the doctor says, go for a walk for 15 minutes or go for a walk for a kilometre, how do we know how far that is? So we've got this additional piece. So when we then think about health literacy, is now only 2 in 5 people can read and interpret day-to-day health information. So that's not your complex health information. That's just day-to-day health information, which means 60% of people can't. So although we're focusing here on people with intellectual disability, when you put a universal design lens on it, it actually is far more people. And so we need to be far more aware that it's not just that person who's coming into your clinic or coming in to have services. It might be their support worker as well. Stress also has a huge impact. So thinking about, if a family comes in with a young child, the level of stress that people carry around medical issues, whether it's a lifelong disability or something that's just happened, your ability to actually read and understand is much less. So why do we continue to provide complex information for people and then expect them to be able to understand? What we need to do is to flip all of that and be saying, yes, I know lots and lots and lots about whatever it is that I know lots of, whatever your health area is. What I need to do is work out what the everyday words are and what does this person really need to know to help them make the decision about, do I go off and have, do I take medications or don't I take medications? Do I have this option or that option of my treatment options that I have? When people can't read and they get given a medical condition or medical diagnosis, it is not now time to go off and teach reading. What we need to do is give them the content and the information to enable them to have enough understanding to be able to make decisions about their own medical journey. So if we think about it in the health literacy space, it's only 2 in 5 people. So to our written information is to participate. It's not showing how many words we know. And it's not about having a reading test. It's not like going through school and going, I can read it at this level or that level or something else. No, I want to have it to be able to know what it actually is all about. Taking out all the complex language, the complex words, the complex sentences, and not overwhelming us visually. So when you think about health literacy, yes, we've got the individual's capacity around their health reading, which is what that red circle is there. What overlaps and sits with it is the health literacy environment, which is what you, as the engaging person, bring to that conversation as well. Because if someone's not used to reading and they have poor reading skills, they're not someone who's going to happily open something and maybe then be able to work out what that means for themselves. It's about what you also bring into that environment. What are you able to, and how much do you know, particularly in the intellectual disability space, about what things helps this person understand? Do you need to be using keyword sign? Do you need to also have some sort of pictorial communication board to help someone? Do you need to look at how much visual clutter is around the space that you're asking this person to sit and read? How much time are you giving them to respond? All of those are your health literacy environment, of which the health information is actually part of that conversation. And you can certainly read more about that. I've actually, there's a couple of extra slides I've left if you go back to the recording that I've actually hidden that we'll be able to pull up for you that have references for all this data. So we've got literacy, we've got numerical literacy, which we know is very poor. We also know that medical literacy is also really poor. What I haven't put in here is a slide about, and now what does that mean in the digital space? So if we have difficulty reading, the likelihood of having a desktop that is open and on and accessing it is fairly low. Once again, it's only 2 in 5 of us can use complex websites effectively to find the information we need. So just putting things up there is not going to help either. So literacy is the issue. What I want to also now just draw your attention to is the significant differences between Easy English and what is being created by lots of organisations, which is not actually supported by the research, and this is what you need to be really aware of, is Easy Read. Some of you may not even realise that they're different. This is where I started when I was doing my analysis after I'd started doing my initial analysis. This is some analysis that I did in 2019. On the left, you're going to see some things on Easy English. On the right is always Easy Read. Just look at it visually. Without even knowing the techniques of what Easy English does, you can immediately see there are significant visual differences in what we're seeing here. Easy English uses very few words. We also know that basically we use single syllable words all the time. We don't insist on putting in hard words, because why should we add 5 or 6 hard words to any document that we're doing? That's just an increase in cognitive load. Our job as writers is to remove all that. Now, you can see that in the Easy Read and in Australia, they also use these photos. These are called photo symbols. Someone, particularly with an intellectual disability, who does not know who this person is not going to engage with this person. Just like you and I, when we look at happy snaps, if I don't know the people in the photo, oh, that's nice, and move on. That's what they do here. These photos also can't be manipulated, so I can't make them look individual from your document to someone else's document. So you might have used something to represent, oh no, I've run out of money. This one here, you can see in the top photo, she's using an image of shaking out her wallet, talking about mate crime. How do I know, as someone with low literacy, that I'm actually using it a different way? In Easy English, we can go and we can manipulate images to make them more individual. The other thing you need to be aware of with photo symbols, if we're thinking about that this is meant to meet the needs of our Australian readers, this is content with people who are not Australian. You put a group of people together, it's not the demographics of Australia. You pull up a building, it's not an Australian building. You put up a garden, you put up emergency services, they are not Australian. So it's an additional barrier to everyone. This is another example. So this is COVID-19 stuff. So one of the awards we received was for all the COVID-19 work we did pro bono. There's still about 20 or so documents sitting on our website. You can go and they're freely available to use. These is examples. So if someone has got low literacy, the last thing they're going to do is pick up a document that got lots and lots of words on it on its front page. So everything in Easy English has a front page so that someone can look at the picture and have an idea of what it is. Easy Read often doesn't do that. You'll also see that their heading, which you should think is one of the most important things, never has an image. How can you work your way through any document if you're actually not highlighting what the image is? This is just a sample page from the two of them. You can see that with Easy English we have lots of white space. Okay, in Easy Read they have somewhere at this stage between 6 and 7 images down a page. So just visualise what that looks like clutter-wise. They use lots of commas. They have quite extensive sentences. In Easy English, we talk about 5 to 8 word sentences. In Easy Read, the average is 14. That's a significant difference. The other thing, a really good way to check whether something perhaps is, so it's not just the front page, it's not just the fact that there's no picture on the headings and the titles, the word if. If-then statements are really quite complex. If you go and do a bit of an edit search and you find lots of ifs in a document, it is likely to be far too complex for most people with intellectual disability to be able to process. And that's what you find in Easy Read. What I just want to finish off with are some examples. These are ones that you can find on our website. We have an Our Work page where you can see these are under the health banner, but there's lots of other topics which you might see as being really useful. So this was a survey for a WAVA. You can see that a survey has that same sort of thing. We've only got 3 or 4 images down a page. It's all very spaced out so people can choose what it is that they're doing. Work. We identified that we needed to create separate resources as part of the survey. This was one of them. I need to go and talk to someone. This is what it looks like to be able to find content. And if people have got low literacy, you can see on the right-hand page, it's even got the step-by-step of where to go looking for things. Often what happens is there is complex ideas that people don't know about, they don't have the language for. We created 2 books here, okay, around violence, and you can see the different topics when you go looking at them. So we didn't include this word emotional abuse at the beginning of it. That's a hard word. We've only put it in at the very end. Children and young people with disability, once again, so this was a flyer and then a conversation about gathering data. Same sort of idea. One of the things is people actually don't know. You go, oh yeah, you're from 10 to 15. They don't realise there's 11, 12, 13 and 14, so we have to name it up. Using the concept of little and big, so do you need more help from your NDIS plan? Building it into something very concrete. Don't know how many of you know about SWAN, Syndromes Without a Name. They have a series of 4 brochures they've created in Easy English. There's also a toggle on their website where people can go and see the same content. We do lots of research for people, so we'll have a document about our study, we'll have tell us what you think, we'll have a consent form, a privacy form, or withdrawal form, all the things that people need to be able to do it and do it meaningfully. Plans, great to have plans, but I'd much prefer to have my SWAN brochures than a plan written in Easy English. You know, it's about having it, what is it that people need? Yes, it's in our plan, but let's also spend the time creating the content that people at the coalface need. These are just some other examples of things that you can go and have a look at that we've been involved in. So our plan for autism from South Australian Health, that's fairly recent. WA Parliament, we did, this was for Aboriginal and Torres Strait Islander and migrant families in particular. That was their focus. We separated that out for them. Consultation for education and COVID-19 and the impact for kids in special schools or kids with disabilities. This this is a list of some new resources which are they're all on the cusp of being available. So my CP guide is actually 40 fact sheets for adults. Cerebral Palsy Alliance is 60 fact sheets for adults. Ronald McDonald House Charities is 5 brochures about what they offer to families around their houses and school supports. And we're also doing a form for their for when you go and stay in their houses. Peninsula Health is just one example of an organisation who has NDIS services that we've created some of their content. Life Without Barriers, we've been doing a whole series of their policies and procedures. So there's lots and lots of stuff that is potentially out there. It's just a matter of looking. We put anything that is available that we know is in the public, we'll actually pop it up on our website. And we're also in the process, because we know digital literacy is such a concern and often content is buried so far, so low and so difficult to find. We've actually got in concept a website for people with low literacy called Read Easy English. It will be going live as soon as we can find the time to upload the content onto it. But thanks for listening, and I'm more than happy to take questions. And I'll take that down.
Thank you very much, Cathy. It's great to actually see the difference. I love the way you put things side by side so we could just see the difference, because I think a lot of us are used to working with documents aimed at different levels of literacy, but it's very unclear which is best practice and what is recommended. I'm sorry, my camera, for some reason, it was working earlier, but it's just stopped working now. So sorry about that.
That's okay. That's fine.
There is. Are you able to see the chat, or do you want me to read it?
I can see that. So someone's
Yep.
asked about the evidence around easy English versus easy read, and can you provide some references? Okay, so this is a really interesting conversation because I've just come back from Portugal for the International Easy to Read conference, and there's only 2 of us that talk about the fact that there's something different out there that we need to be thinking about. So in Slovenia, they recognise that there's 4 levels. So a simpler level than what we do, which is based around taking simple content but using objects in the environment to support someone. So someone who's got absolutely no literacy skills at all, who may not even be symbolic. The very simple level that we're creating, which we're thinking universal design, easy read. And then there's another level that they do a lot of for people who are perhaps, you might see them as like self-advocates, who perhaps got some reasonable literacy skills, but perhaps have got a poor educational or poor general knowledge that can't quite cope with the plain language. So that level 4 that they call it is actually without images as well. So it's quite different and very much closer to that. So I'd be looking at, in terms of easy read and the challenges around easy read, Susan Buell's research is really valuable there. I've certainly got some stuff on my website around the work we're doing. And Deborah Chin is